Hello. Welcome to Medicare Essentials. If you're ready to enroll in Medicare or planning for the future, you've come to the right place. You are not alone. Did you know 60 million people are already enrolled and 10,000 people just like you join Medicare every day? We understand every Medicare decision is personal, and our team is here to help. In the next few minutes, we will cover what Medicare is, the costs, and how you enroll. We will also go over your big choice on Medicare Advantage versus Medigap. And finally, we'll discuss health, budget, and lifestyle, and how they influence your decision on enrolling into a Medicare plan that is right for you. Before we start, always remember that it is free to work with a licensed health insurance advisor. It is not just about enrollment. Our team of experts at Benefica is available year-round to assist and answer all of your health insurance questions. Okay, let's start with the basics. Medicare is a national health insurance program that sounds a bit like alphabet soup. There are parts A, B, C, and D. And then there are Medigap plans, otherwise known as supplements. Medicare Part A is hospital coverage. 99% of Americans qualify for Part A premium-free because they or their spouse have paid Medicare taxes for 10 or more years. Medicare Part A includes hospital care, skilled nursing, hospice, and in some cases, home health care. Although you may have no premiums for Part A, currently there is a $1,364 deductible when you are admitted into hospital care. Medicare Part B is medical coverage. This includes doctor visits, lab tests, outpatient surgeries, mental health services, ambulances, x-rays, flu shots, and durable medical equipment such as wheelchairs and oxygen tanks. Medicare Part B has a monthly premium starting at and currently has an annual deductible of $185. Under Part B, the government pays 80% and you pay 20% of your medical bills, but there is no cap on how much you could pay. Together, Parts A and B make up what is known as Original Medicare. While Original Medicare covers your basic healthcare expenses, it doesn't cover everything, and costs can add up. Original Medicare does not cover hearing, vision, dental, prescription drugs, gym membership, or medical emergencies overseas. Because of the gaps and expenses, about 85% of people with Original Medicare sign up for additional coverage. Let's look at one of these supplementary coverage options: Medigap plans. With Medigap, you keep Original Medicare, and your Medigap plan covers many, if not all, the costs that the government does not pay, such as deductibles, coinsurance, and excess charges. Medigap plans may have additional benefits, such as gym membership and emergency coverage when traveling outside of the country. Here are some key points to know about Medigap plans. You can use your plan anywhere in the U.S. that accepts Medicare, and if you move address, you can keep your plan. They are guaranteed issue when you are first eligible for Medicare and in limited scenarios, meaning you cannot be denied coverage. And once you have a Medigap, the benefits cannot be changed or taken away. You may have noticed that Original Medicare doesn't cover prescription drugs. We suppose back in 1965, when Medicare started, medications didn't cost so much. Medicare Part D, which is prescription drug coverage, began in 2006. Although regulated and subsidized by the government, Part D plans are provided by private insurance companies. Unless you qualify for a subsidy, you will pay premiums, and depending on your plan, may be responsible for co-pays, deductibles, and coinsurances for the medications you need. The formulary, or list of covered drugs, on each Part D may be different. When choosing a plan, check your pharmacy is in network and your medications are on the list. Our advisors can help you check this. You can have Part D as a standalone plan with Original Medicare, or combined in a Medicare Advantage plan. Whichever option you choose, it is important that you have Part D coverage to avoid a permanent late enrollment penalty. Now we've covered A, B, and D, you might be wondering, what happened to C? Well, Medicare Part C, known to most people as Medicare Advantage, is private insurance that replaces original Medicare. With Part C, the government pays a monthly fee to private health insurance companies in return for managing your health insurance needs. Medicare Advantage plans must offer the same or better benefits as original Medicare. Many offer additional benefits, such as wellness programs, dental, vision, hearing, and more. Medicare Advantage plans provide a cap on your maximum out-of-pocket costs, although you may face higher costs if you do not stay in their network. Medicare Advantage plans are similar to traditional health insurance plans that you may be accustomed to. They have a network of providers and facilities you can receive treatment from. You share costs until you reach your out-of-pocket maximum. Medicare Advantage plans often include drug coverage and are then known as Medicare Advantage Prescription Drug Plans, or MAPDs. With Medicare Advantage, you can only have a separate Part D if it comes from the VA, a union, or a retiree plan. With Medicare Advantage, your premium and benefits can change each year. You can review your options during the annual enrollment period from October 15th through December 7th every year. So, when does your Medicare coverage start? Well, for most people, Medicare begins the first day of the month you turn 65 years young. If you are receiving Social Security before 65, you will automatically be enrolled into Medicare Parts A and B. If you are not receiving Social Security, you must self-enroll. Your initial Medicare enrollment period is a 7-month window around your 65th birthday. It starts 3 months before and ends 3 months after the month you turn 65. The following are options to enroll in Medicare. You may enroll online at www.socialsecurity.gov. You may call Social Security at 1-800-772-1213 or show up in person at your local Social Security office. However, with long lines, the other two options may be quicker. Once you have your Medicare card, you may enroll into other Medicare options, such as Medigap, Medicare Part D, or Medicare Advantage. Whatever option you choose, you must continue to pay your Medicare Part B premiums. So how can you decide whether a Medigap or a Medicare Advantage plan is right for you? Your lifestyle, budget, and health are key considerations. You have worked hard to get to Medicare, and now you want the freedom to pursue your interest without worrying about health insurance. Remember, you can make changes to your Medicare plans every year, adjusting coverage as your lifestyle or health changes. There are plans tailored for every phase of your life. We often think in terms of your go-go, slow-go, or no-go years. If you're in good health, your annual expenses will be less than if you have a chronic condition, or if you are planning new knees or hips in the coming year. Some plans have lower premiums but higher out-of-pocket costs, while others have higher premiums but little to no out-of-pocket costs. You may find that the lowest premium plan may not be the cheapest option for you. Before you enroll into a plan, always ask how much it will pay for each of the following: inpatient hospital care, doctor and specialist office visits, outpatient services and surgeries, durable medical equipment, medications, medical coverage while away from home. Enrolling into the right Medicare plan is an important decision for you to make. Make time for free advice from an independently licensed professional and be rest assured that you are well on your way to a great Medicare experience. Are you ready to start preparing your Medicare game plan? Ask us for a copy of our Medicare Playbook today.